Welcome to the Center for Science and Environment's initiative on the occasion of the World Antimicrobial Awareness Week 2020. CSE is a non-for-profit organization based out of New Delhi. We are a public research and advocacy organization. My name is Rajeshwari. I work in the food safety and toxins team here at CSE, where we've been working on the issue of antimicrobial resistance for about a decade now. And we largely focus on the animal and environmental aspects of the AMR problem. Now, AMR, as we all know, is a global public health threat, and more so is antibiotic resistance. Antibiotics are becoming ineffective due to their misuse and overuse, and it's time that we act on it. So this series that we are doing is CSE's initiative entitled Act on AMR, where we are engaging with global experts across the world to understand what they have to say and what they are doing in terms of AMR containment efforts. Today we are going to look at the successes and challenges that are involved in bringing about two most important things when it comes to AMR containment. One is, of course, research, and the second is policy making. And to tell us more today, we have with us Dr. Timothy Jinks from the Wellcome Trust. Dr. Jinks is the head of the Drug Resistant Infections Priority Program at the Wellcome Trust. And today we're going to have this conversation with him and know more about what he thinks we should do, on what track should we move on. A very warm welcome to you, Dr. Jinks. We are really pleased to have you with us. And at the very outset, thank you for being part of this initiative and doing this for us.
Thank you. It is my pleasure to join you, and it's really quite an honor to be able to speak with you and share with your audience the important work that CSE has done. It is hugely impactful across the space, particularly the role of environment and human health. And antimicrobial resistance is one of those particular issues that needs further attention. So we certainly welcome all of your efforts in this space.
Thank you. So Dr. Jinks, without wasting time, we should quickly get on with the conversation. And to begin, we would like you to tell our viewers about what the Wellcome Trust is doing in terms of the global AMR containment efforts. If you could tell us.
Yes, thank you. And Wellcome Trust has supported research around the issues of drug-resistant infection and antimicrobial resistance literally for decades. This has been a problem that from the medical and scientific communities that we've known has been rising, an increasing threat to public health. And the basic research in epidemiology was telling us that. But what we were finding is there was not significant impact on the agenda to solve this problem. So we launched a priority area 4 years ago, and that is one that we are focusing on advancing new tools such as new antibiotics, diagnostics, vaccines, other preventative measures, as well as trying to advance the policy action in particular. In the past 4 years, we focused at the global level, but we are now transitioning where we're wanting to move to national action. So we are still looking to see the advancement of the new tools and interventions that can help solve this problem and protect human health, but it's clear that there needs to be better action on the ground.
Right. So what I understand is, if I understand correctly, is that it's a two-pronged approach that you're taking. One is to look at the research and then the global policy making as well. Now, if I take focus on the research aspect, if you could tell us what has been some of the key areas of progress as well as challenges when it comes to doing research related to antimicrobial resistance, because there is a lot of talk about need for evidence generation. So how important is it, and how is the Wellcome Trust approaching it?
Of course, evidence is fundamental to inform action, and inform action in a number of different ways, whether that is how do you develop the next discovery that's going to create an innovation you need, or actions in the form of policy interventions. And what I would say is that while there has been quite a lot of discussion about the shortcomings of evidence, what we do know, there's sufficient evidence to tell us that this threat is not only very real, it is also very significant. And this is something that's become a little bit of a problem and a distraction. While there are a number of areas we do indeed need to increase the evidence that we need to act and that we need to act with urgency is very, very clear. And that's that's one of the big take-home messages I want people to understand here is while in the deep science, there's much more we need to do and much more we aim to do. It's not a question of, is this a problem? It's a question of what are the best solutions? And so indeed, if we look at those areas of where do we need to understand more, we need to understand the linkages between human behaviors and activities which are driving antimicrobial resistance, and what are the best opportunities for interventions relevant to the place where the problems exist. So there's not going to be one size fits all solutions here. And that's a hugely important thing. We are also focusing on the innovation for new products with a big focus on new antibiotics and new antibiotics that can address the global public health needs. This is something that we hope will essentially buy the world more time while it sorts out all of the other matters so that we can best contain antimicrobial resistance and prevent drug-resistant infections. We need to think about this as a very long-term set of actions that need to be deployed step by step, year by year, so that we can truly achieve containment of antimicrobial resistance.
Right. But I also have an interesting question in our experience of focusing on the environmental aspects of the AMR problem and engaging with stakeholders. There has been a lot of talk about need for evidence for AMR in the environment. Now, either we could create evidence, wait for more evidence, or we could take on the precautionary principle and start taking some actions at our end. So what do you have to say about this, and what are your thoughts on the need and importance of supporting evidence making in terms of AMR in the environment as an important area that needs to be focused?
You raise a very important point. The environmental dimensions of AMR are really critical here, and we must not overlook environmental dimensions. Yes, there's much technical debate about the lines of transmission through the environment, the degree and scale of impact that is there. But again, like I said before, whether or not there is an environmental dimension that impacts on human health is not really the question. The question is, to what degree and what are the best interventions to protect human health at the end of the day? And yes, we want more evidence around the best interventions, but we mustn't distract ourselves with, is this really a problem? And we know, for example, there are some hotspots which do drive the load of the threat in the environmental niche. Industrial outflows, for example, and particularly those from the pharmaceutical industry and pharmaceutical pollutants are a very, very serious issue. And those related to antibiotic manufacture, where it actually supports the breeding of antimicrobial resistance in natural bacteria, as well as those bacteria which can be pathogenic, and therefore increasing the threat to humans to pick up drug-resistant infections from the environment. Another area as well that there is a hotspot is from the outflows from hospitals. Hospitals, of course, have a lot of people who are being treated with drugs and antibiotics, which do end up in the sewage from the hospital, but also there's a huge, huge environmental load resulting from the pathogens that sick people excrete. And so again, these are two areas where we know there are hot spots. They need attention. Let's not debate. It's an issue. I think it's not really even precautionary principle. The evidence is clear enough. And it's a question of what are the best interventions, those that can achieve the desired impact, and of course are suitable and relevant to the location where things are being deployed.
Right. I think that's a very crisp and comprehensive answer, and really thank you for bringing out these the idea of hotspots and how these are the areas that need even more focus when it comes to being able to containing AMR emanating from the environment. Um, Moving little towards the other aspects of the work that you mentioned at the beginning, which is the global policymaking process. Now, one is of course you have been engaging in this process. So, what do you think? Where are we going in terms of global policymaking? I mean, if I can ask you. In a very straightforward way, what is happening right, and what are the areas that needs more focus and attention? Uh,
Yes, so what we've seen is that antimicrobial resistance is recognized at the global level as a global public health threat, and this culminated in the UN recognizing it in a declaration in 2016, only the fourth time in the history of the UN that a public health matter has been taken on board, and that was a major turning point in terms of global governance, that the governments of the world acknowledge that this is important and we need to turn our attention to that. Since then, there has been progress following up from that. The UN Interagency Coordination Group that emerged from that process has provided recommendations to the world's governments, of what must we do collectively to be able to achieve this control for AMR. Now we've reached a phase, though, where really progress is threatening to slow and stall down to nothing much happening. We fortunately have the emergence of the Global Leaders Group, or Leadership Group, as it's called, from the tripartite. I think this will be a very important change in terms of global governance. It creates a focal point in the community of multinational stakeholder engagement. But behind that, we are really at a point that I am concerned. So where do we need to turn more attention? Of course, we need to make sure that the Global Leadership Group gets off to a fast start and doesn't actually look to go back to the beginning. Because this is decades long of an issue, and really that group needs to come out of the starting blocks moving quickly. Behind that, we need an independent expert advisory group that can look at and analyze the data, the evidence, and help to translate that into information that the Global Leadership Group and countries of the world can more easily look at and determine, well, what are the actions that need to be taken. Of course, I cannot avoid talking about the COVID-19 pandemic and the effect that that's having on everything we do in our lives. And of course, it is having an impact around the global governance of AMR. AMR, in some ways, right now, looks like it might not be such an important issue. Obviously, we have the raging pandemic of COVID-19 that needs to be solved. But what are the collateral impacts of the COVID-19 pandemic and everything that's happening around that, and the rebuilding that everyone will have to do around the world in the wake of the COVID-19 pandemic? I am concerned that AMR not only has taken a back seat for the short term, as it rightly should, but it will stay in the back seat for the long term, that somehow AMR will be viewed as of less importance. And even worse, combined with that, that we will have a terrible sense of fatigue that we can't face another global health issue that we need to solve. And so those two drivers, for me, are very concerning in terms of where can we go. So we need to make sure that the awareness of AMR as a slow-moving pandemic is spread broadly, that people need to understand this really is important. We need to make sure that the relevance of the issue, why should people really care? It's not just that it's this thing at a distance. There are people who are getting untreatable infections that lead to death often, but the high level of both morbidity and mortality is increasing. But it's almost a hidden pandemic because it's a number of diseases in a number of places, and it's undermining modern medicine. So antimicrobials are a foundation piece in modern medicine, and it's right now that foundation is crumbling, and it will increase the difficulties in achieving health care for all, and certainly the desired goal of universal health. It will be a long way off if we lose this foundational tool that supports modern medicine.
Right. Uh, Dr. Jinks, I had this question in mind, but I think you have brought it in your answer itself. This linkage with COVID-19. Uh, there was a time a couple of months back when everybody was talking about how antibiotics are starting to get misused because of COVID. And now that you raise this concern, of course, antibiotics are a public good. It's designed for treatment, and when we are not able to preserve it, and your concern stands very valid, and it's actually very worrying when it comes to the entire global governance talking about it, but then what is happening on the ground. There are two different things. uh, but if I may ask you, Dr. Jinks, in your experience of engaging with countries now, I understand that you do a lot of work with countries. And in terms of AMR, how has been your experience with policy making, research, implementation with these countries? Do you think it's easy to work? It's difficult to work. A lot more needs to be done. What is your perception about engaging with countries?
Well, that's a huge question because, of course, when we think about countries, there are so many countries around the world, and each one is an individual place. And this is one of the difficulties that when we talk about having a global agenda, quite often you run the risk of oversimplifying to a single thing and create something of a barrier for engaging each country as is important for that country. So to try to get to answering some of your questions, of course, there are some countries that are making incredibly good progress in tackling antimicrobial resistance. And there are those who are struggling, and then there are those that are really doing nothing at all. You may be aware that part of the big plan with the global agenda is that each country should design a national action plan. And those national action plans are shared with the World Health Organization. And most of the countries of the world have indeed come up with a national action plan. And that's a nice first step, though in many cases it's a very, very small step. What we see is a lot of countries have produced the paperwork, but there's no real action behind that. So what we are finding is, depending on the country, the circumstances in the country, it can be quite varied. There's an important thing that really differentiates where countries might stand on a progress scale. And first of all is whether or not there's political leadership that has willingness to address the issue. And another key ingredient is whether or not there is a champion within the country And those champions can take many different forms, but they are a necessary ingredient. So it's the political will as well as the champion within the country to help drive things forward so that it's more than words, it's actually about actions, and that the National Action Plan is not actually the end point, but it's the start point for what can happen. Um, we are looking to see how we can best help to engage with countries and others who are working at the country level to make progress on this transition from talking about action to enabling action. And we recognize that it's not going to be solved instantly. It's going to take a long time, but we think that there needs to be a greater sense of urgency to move forward. And one of the things we will be looking to the global governance level is how that global governance can help to reinforce what can happen and to help countries to work in a way that collectively we're all making progress. And that's not to say that everyone's doing the same thing. That's not the right way forward, but that each country is able to move forward in the way that is most relevant to that country's circumstances.
Right. I agree with you, Dr. Jinks, when you say that each country is unique, and it's more about political commitment and having AMR champions. Another point which we get to understand as we engage within countries in Asia and Africa is that the lack of or maybe the dearth of dedicated funds for AMR, be it action plan implementation or research or anything in terms of AMR. We also understand that even dedicated resources, uh, you know, is something which is a need at this point of time. Uh, and when you say that, if it's more than it's more than words, it's more than talking, it's more than acting on the ground. I think that very much aligns to the theme of our series when we decided that the name of the series should be Act on AMR. You know, uh, my last question to you would be, Dr. Jing, something that I take out from your last answer is, how do you think that the global governance or the global efforts that is happening can be aligned to suit the needs of some countries who are maybe not as well equipped, as well strengthened to make progress? The developing world. How do you think, is it happening? Is this kind of alignment happening, or there is a need?
I think we have the seeds around making those things happening, but those seeds not yet germinated. The funding is always a problem, and it's not limited to the AMR space, or even to matters of public health. And indeed, to come back to the COVID-19 pandemic and part of the broader crisis is that funding will be not only in shorter supply, but will be for an unforeseeable period of time. The economic consequences of the COVID pandemic 19, it's huge, and in ways we don't understand yet. So we thought the situation was bad enough 12 months ago on, well, where do you find the funding to pay for these things? Well, the situation is worse now. So is that a reason to give up? Of course not. It's more that we actually have to work harder in finding solutions to this. And the funding situation cannot simply be, okay, can we find a big pool of donor monies and distribute that? We have to be much, much smarter about this. And it's about looking at AMR and how it fits into the broader global health security agenda, and making sure that it is integral to that and sits within the overall package of things that need to happen with global health security as a whole. And that too needs to fit into the broader agenda. And when, as we talk about those countries most in need, it's the development agenda. And what is the role of this health security in supporting the development of countries who need the most support to make progress. So this is an area where there has been good thinking, but we actually have not come up with the real solutions to move that forward. And that's something that I hope in the next few years we can see real progress. And this has to be done, of course, at a higher level. I don't think it necessarily requires an entire global consensus. It simply requires that there's a coalition of those committed to achieving change, and that we can find enough agreement so that there is an alignment between AMR fitting within global health security, fitting in to a development agenda, and one that can help identify the necessary donor funding to support those countries who are going to require donor funding, right? I mean, there's no two ways about it. We are talking about donor funding at the end of the day, but we need to figure out how to tie it into the broader set of activities that are there to help advance those countries.
Right. Um, it's been really, really nice getting to know these perspectives from you as one of the key persons working with the Wellcome Trust. What I take from this discussion is, the first few minutes where we talked about the focus is having good health. It's about human health and and finding out what are the best interventions, whether it's the animal side or the environmental side or the plant side. The larger mandate is to save human health and focus on all these aspects through research, through global governance and policymaking. Last few lines from you, Dr. Jinks. Is there reason to sit still, or there is reason to be more worried now, even in the COVID context? I know you've touched upon all these in the discussion. Maybe just a few closing lines that you would like to make.
Yes, it certainly is not a time to sit still. We need to redouble our efforts now. That's not to say that I'm worried that we are facing complete failure here. I actually am optimistic if I take the long view. But where I do have concerns is that maybe we are taking our eye off the ball and at risk of losing the momentum that has been gained, particularly over the last 5 or 6 years. We've built up a head of momentum. We need to get things across a particular short-term milestone so that we have enough energies to carry us forward through the next decade and longer, so that we can truly talk about controlling AMR. This is the thing that I think we have to get our heads around. The first serious efforts of looking at this go back to the 1960s. And of course, we're aware, Alexander Fleming himself said, this is a problem from the very beginning. But it's taken us this long to really get engaged with the implications on human health, public health, societies and systems, and think, gosh, we actually have to do things very, very differently here. This miracle drug of antibiotics has provided us some cheap shortcuts in a lot of ways. It's meant that our health care can be done in ways that we're not as careful about infection prevention and control measures. It means in agriculture, we can be really, really soppy in our animal husbandry and our food production processes. Well, we are paying the price for abusing and overusing this wonderful tool because it's not a perfect tool. Evolution's a crafty thing, and the bacteria and other pathogens, they find their ways around these interventions. So we have to change a lot of what we do so that we actually can move to a long-term sustainable position. So you very rightly say, the goal here is about protecting human health, but it cuts across a number of dimensions. And we need to, in an ordered fashion, pick through each of those dimensions so that we can reach a point where we can sustainably address the issue and we can achieve that goal of protecting all people from drug-resistant infections. And that's about controlling AMR. And I do want to say, if I can add in, we focused a little bit around essentially low-income countries, but there is a huge role of the middle-income countries of this world, both the lower and upper middle-income countries, because really these, I think, are the countries where both the biggest threat lies today, where there are more people dying as a result of AMR, but also there's the more opportunity to make the major gains that we need to see. And so middle income countries have a huge role to play and also a huge responsibility in it. So it's a different situation that needs to be taken on board, that there is a responsibility to own by the middle income countries.
Right. Thank you so much, Dr. Jinks, for beautifully summing it up. I think I don't need to sum it up anymore because you closed it beautifully. Uh, what you mentioned is, AMR antibiotics are something which is very foundational to human health, and thanks for letting us know that there is hope, there is optimism, but we need to act fast and we need to act now. I think that's the strong message that I take from you, and it's been really nice, engaging with you and talking to you, Dr. Jinks. Again, once again, I thank you for being part of this initiative and talking to us. We hope to be in touch with you, and we really hope today that stakeholders who have watched us, who have viewers who have been watching this discussion, really take a good takeaway message from this discussion. And you can reach out to us as well as Dr. Jinks if you want to know more about these issues, as well as the Wellcome Trust. Thank you so much, Dr. Jinks. It's been really pleasure talking to you.
And thank you.